series on the revision EMQs. Today we are dealing with the management of acute management of a trauma patient. Okay, the first question is on chest trauma. Choose and match the correct diagnosis with each of the clinical scenarios below. Okay, the 5 clinical scenarios, read them carefully and match with the correct diagnosis on the left. You pause the video, answer the question, and resume the video to get the answers. So the answers to the questions are as follows. Okay, question number 2, investigations in trauma. Again, you are given 4 investigations, emergency investigations, and 4 clinical scenario. You are supposed to match each clinical scenario with the correct investigations. As usual, pause, answer, and resume the video to get the answers. Okay, the answers to these questions are as follows. In this question, number 3 on abdominal injury, there are 6 case scenarios. Read carefully and match them with the appropriate diagnosis given on the left. As usual, pause, answer, and resume to get the answers. And here are the answers to the questions. Four here is on the types of shock. Again, there are 7 clinical scenarios. Match them with the appropriate type of shock described by this clinical scenario. You pause, answer, and resume for the answers. The answers to the question are as follows. Complications of blood transfusion. Choose and match the correct diagnosis with each of the scenarios given below. Here are the 5 scenarios and here are the diagnoses. So please match them appropriately. You can pause the video, answer the questions, and resume to see the answers. And these are the answers to the question. Now let's go through some principles of management of trauma, adopting the so-called Advanced Trauma Life Support, or in short, ATLS. The initial treatment of the patient of trauma starts at the time before the patient reaches the hospital, the pre-hospital state. The pre-hospital state where airway control, external hemorrhage is stopped, and the rapid transfer of the patient to the nearest hospital. At the hospital, the primary survey takes place, which is the initial assessment and resuscitation of vital functions, giving prioritization based on the A, B, C, D, E. Thirdly, the primary focus of the ATLS is on the first hour of the trauma management. Okay, that is where the rapid assessment and resuscitation is carried out. This is known as the golden hour. Okay, the concept of the golden hour was originated by Adams Cowley, which refers to the first 60 minutes after the occurrence of a multi-system trauma. The victim's chance of survival are greatest if they receive definitive care in the operating room within the first hour after a severe injury. Okay, the main thing that takes place during this golden hour is the rapid resuscitation of the patient. restoring circulating volume, improving oxygen delivery, prevent cellular ischemia and tissue necrosis, prevent onset of secondary cellular injury, and prevents the onset of multi-organ disease. Good management of the trauma patient. First, assessment and classification, resuscitation, diagnosis with the various imaging investigations, treatment, general, initially is general and supportive, followed by definitive medical and surgical treatment, and followed by post-operative care and rehabilitation. The emergency resuscitation involves the giving of adequate fluids and electrolytes, airway and respiration are secured, blood is grouped and cross-matched and transfused if necessary, patient is given oxygen, adequate analgesia is to control the pain, especially for chest injuries where you want the patient to breathe without comfortably with analgesia. Monitoring continues, BP, pulse, oxygen saturation, urine output, and in some cases you may want a central venous line. Must be emphasized that treatment is a team effort, a team trauma team. The trauma team, if ideally you have a trauma team, they should be the ones entrusted to treat these patients. And then emergency investigation, fast treatment, fast, CT, TPL, and TL. Okay, after resuscitation, the patients are usually categorized based on their physiological state after the initial resuscitation into first, hemodynamically normal. So in these patients, investigations can be completed before treatment is planned. The second group of patients classified as hemodynamically stable. In these patients, investigations can be done but limited. It is aimed at establishing whether the patient can be managed non-operatively, angioembolism, or surgery is required. And the third category is when hemodynamically the patient is unstable, where all investigations need to be suspended, immediate surgical correction of the bleeding and other injuries is required immediately. Okay, now we come to the primary survey. Primary survey consists of the following steps. A, and securing the A, B, C, D, E, A for airway, assessment and protection, including stabilization of the cervical spine. Breathing, B is for breathing and ventilation assessment to maintain adequate oxygenation. Third one, circulation assessment and control of external hemorrhage so as to maintain adequate end organ perfusion. Disability assessment by performing a basic neurological evaluation of the patient, and exposure with environmental control. Undress the patient, search everywhere of possible injury while preventing hypothermia. Okay, ATLS, primary survey. This is a summary: airway, breathing, circulation, disability, and exposure. Now, once the patient is stable, then the secondary evaluation of the patient takes place. Okay, this includes for looking out for the blunt abdominal trauma, such as hollow viscous injury, pancreatoduodenal injuries, and diaphragmatic rupture. Penetrating abdominal trauma, especially rectal and ureteral injuries. Thoracic trauma, such as aortic injuries, pericardial tamponade, and esophageal perforation. Extremity trauma and fractures, which is important to establish the severity of and nature of fractures. And vascular disruption and compartmental syndrome must be promptly identified, recognized, identified, and treated. So the key components of the secondary survey include a good history, ample, observation at the scene, physical examination head to toe, tubes and fingers in every orifices, complete neurological examination, palpating for spinal tenderness, musculoskeletal checks, and special diagnostic tests. Keep heart neck collar on all the time, re-evaluation to minimize missed injuries, and painkillers as appropriate. Okay, now we come to the emergency treatment. Investigations. What are the investigations that we carry out for these patients? First, it is called FAST, which stands for Focused Assessment with Sonographic in Trauma. So it's an ultrasound scan, emergency ultrasound scan. Emergency CT scan, diagnostic peritoneal lavage, and diagnostic laparoscopy. Previously we used to do a diagnostic laparotomy, but nowadays I think it is less minimal in surgery. Diagnostic laparoscopy is done. Abdominal trauma investigations. Look for the fast investigation by ultrasound. Detects free fluid for blunt trauma. Looking at solid organs in the retroperitoneum and diaphragm. This is a ultrasound, fast scan ultrasound showing fluid here. This is the spleen, kidney, udders, splenorenal space here, free fluid, which is suggestive of blood. Here, ultrasound of the pelvis shows free fluid outside the bladder, which is blood. Ultrasound evaluation of blunt abdominal trauma includes a fast scan, positive and negative. If negative, patient is unstable, repeat DPL. Otherwise, stable, repeat the CT scan. If it's positive, the patient is stable, you do a CT scan. If it's unstable, you may go for laparotomy or laparoscopy. What is diagnostic peritoneal lavage, DPL? In diagnostic lavage, a tube is inserted from below the umbilicus into the peritoneal cavity, and this is then connected to a tube, and then you aspirate to see whether there's blood. If it's grossly positive effluent, then it's positive and surgery must be done. Otherwise, if there's no fresh blood coming out, then you run in some Hartmann's or some saline into the to do a lavage, and you drain out the fluid, and if the fluid is blood stained, then it is positive. The positive DPL is a sensitive test for determining intra-abdominal injury. It's especially useful in places where they do not have a fast scan. Positive test is when aspiration of more than 10 mL of free blood or RBC greater than 100,000 per milliliter. If gross blood is not if all investigations are unable to detect intra-abdominal bleeding or significant bleeding, then the patient, and if there's not enough time as the patient's condition is unstable, then there is a role for diagnostic laparoscopy and proceed. Diagnostic laparoscopy is good for evaluation of peritoneal penetration and diaphragmatic injury. The rate of unnecessary laparotomy ranges from 27.6 to 45%, even in peritoneal penetration is confirmed. Therefore, diagnostic laparoscopy is a very useful investigation and treatment for patients with suspected intra-abdominal injuries. Okay, in trauma, it is very important to keep track of the coagulopathy, metabolic acidosis, and hypothermia, which together is known as a lethal triad for trauma, which are the predisposing causes for the death in trauma patients. Okay. Now, next I'll show you a short video on the evaluation of patients with trauma.
Evaluation of the trauma patient, ATLS protocol, the Advanced Trauma Life Support, ATLS. It is the
Thank you for joining me for this short session. Hope to see you again in another.